Sometimes, it's not time that heals all wounds, but flowers, steeped gently into a cup of tea. Inspired by founder Lisa Lee's own healing journey from thyroid disease and burnout, The Chi is a wellness brand based in New York City on a mission to help people feel more joy, calm, and connection through the power and beauty of flowering teas. The Chi was born from the discovery of rare, single origin whole flower teas rooted in centuries old Eastern rituals. Each bloom is hand-picked at peak vitality by small family-owned farms across Asia to offer a grounding, sensorial experience that reconnects you to yourself, one cup at a time. Choose from the Shangri-La Rose, Blue Lotus, and the Royal Chrysanthemum and get 15% off at the-chi.com. That's the-qy.com with the code FRANZ. That's FRANZ. One-time use and cannot be combined with other codes. Drink flowers, feel alive. Imagine if skincare could do more, but with less. Meet Remsen, a New York brand made in South Korea, where world-leading innovation meets the no-nonsense energy of New York City. Their essential duo keeps it effective and efficient with high-quality ingredients. Their Gentle Greens cleanser, featuring green tea, centella, and aloe, cleanses without drying. And the multitasking peptide moisturizer combines bakuchiol, ceramides, and a clinically proven dose of peptides in a single lightweight step to hydrate, strengthen the skin barrier, and help prevent visible signs of aging. Both are safe for sensitive and acne-prone skin types, vegan, cruelty-free, and beautifully packaged with sustainable materials, making the set a great gift. You can get 20% off your first purchase on remsenskincare.com. That's REMSEN skincare.com with the code FRANZ. That's FRANZ. One-time use and cannot be combined with other codes. Get maximal results with minimal steps. Hi, everybody. Welcome to another episode of the Friends of France podcast. We are here with one of my good friends that, interestingly enough, we've only met a few times in person here in New York City, but we were able to go to the Middle East for almost 2 weeks. And here we're about to talk today about one of his passions and his profession as well. And it's something that he's told me about. And I've been so interested about it. I'm so honored to have him on today. Francois, how are you doing?
I'm doing really well. Super excited to do this. And of course, thank you for having me on.
Of course. Well, I just wanted to ask, I remember when we were in Lebanon, I think on our first day, we were just chilling, waiting for everyone to come in. Shout out to Calvin and the Monsoon Diaries. And I remember we were talking about life and whatnot, and you were talking about your endeavors within this field that I never really heard about before and I knew nothing about, which is performing arts medicine. I remember you talking to me about this. I was like, wait, that is so interesting. We need to get you on the podcast. And this was September 2023. And I can't believe that the time has finally come. Well, before that, I wanted our audience to know more about you. So if you could introduce yourself to us.
Well, hello, people of Friends of France. My name is Dr. François DeAsis. I am a physician in physical medicine and rehabilitation, and my specialty is performing arts medicine. I've had a kind of an interesting path to this ever since, growing up. I'm from Chicago, and growing up, I was introduced to music at an early age. I started off on the piano and eventually transitioned over to the violin. Music became a really important and it still is an important part of my life. In fact, I actually studied violin in undergrad. It's one of my undergraduate degrees. But through life, I also was exposed to medicine and, due to certain things happening, I was also very drawn into that whole component of, just being with people at their most vulnerable time. And so eventually I found my way to medical school. Like I said, I grew up in Chicago. I did my undergrad in Chicago. I also did medical school in Chicago. And I started my slow journey around the country. I did intern year in New Jersey, actually starting in 2020. Everyone knows what happened then. And then the year after, I moved down to Miami to start my residency training in physical medicine and rehabilitation. And in a very full sort of circle thing, I recently just moved to the Dallas Fort Worth area to do my fellowship in performing arts medicine. And that's something I was very lucky to find out about because, as myself included, performing arts medicine is a very niche field that a lot of people don't know exists. But for me, as someone who, music and medicine and the arts are a huge part of my life, I was very lucky to meet certain people that were able to guide me to what I would say is almost a dream come true for me.
Yeah, I love that story. I mean, I feel like medicine and music seems like polar opposites, right? Because I also studied nursing and theater in college. And people would always tell me, "Oh, you're doing both." It's so different. They're like polar opposites, like different domains within society. But actually, the more you think about it, it's actually as similar as they can get, right? They both exist to kind of like serve people. And also, like, as you said, maybe in people's vulnerable times, right? You can receive obviously medical care and at the same time receive that comfort that you get from music and from hearing it or even from performing it. And speaking of your journey of getting into performing arts medicine, and I'm sure some of my audiences, so it's kind of like me when you were first telling me about it. It's like, what the heck is performing arts medicine? Is it using medicine and performing arts, or what is it? What is the premise of this domain that you're right? Many people have not heard about before.
Yeah, that's a great question. I think the easiest way to describe it is that we take care of the various types of injuries that all performing artists, whether they are dancers, singers, musicians, actors, all the unique sort of injuries that they might incur over the course of their career as they're producing their art. I mean, that's the layman's term, but outside of treating those physical injuries, it actually goes a lot deeper than that. Because, in the sense that performing artists, one could say that they're almost an underserved population in healthcare. And the reason that is because, when, for example, overuse injury, right? Like for a normal patient, the typical workflow is, or the management is like, oh, just rest, hey, maybe take some anti-inflammatories, take a couple weeks off and just slowly get back into things. The thing is that in the artists out there who are listening, I'm sure you can relate to this, is that in the arts world, you can't really do that because of the level of skill that's required for a lot of the performing arts. You can't afford to take 2 weeks off, whether it's because of, obligations or you're preparing for something or you're just trying to get better as an artist, right? So because of that, if you tell a musician, for example, like, hey, you have this injury, you got to take 3 weeks off. That's not realistic, right? And so with performing arts medicine, a lot of us, interestingly, and probably not surprisingly, we have a background in the arts, right? Whether it is like myself, I am a musician. My mentor is a musician, and another of my mentors is a dancer. Others are singers, right? And so we understand that there's a certain nuance to the way that to taking care of our artists, right? And so what we'll do is the first time we meet with our patients, right, we have a long conversation and we figure out who they are, what their goals are, where they are in their careers. Given that, on top of, whatever injury they're coming to us for, we will help them create a very specialized, individualized plan so that they can still keep doing what they're doing, but at the same time, not overdoing it such that they might sustain a career ending injury.
Yeah, for sure. It's very interesting, kind of also comforting to know that most of the physicians and specialists who enter performing arts medicine do have a background in performing arts, right? Or in music or acting or in dancing or whatnot. Because I guess it adds that more personal flavor to that personalized care, like more of like, oh, I understand what you're going through and what you need. But even on top of that, I guess, history of that personal experience, I'm sure being a physician and a subspecialist too, the training and the education towards that route, I mean, such a very specialized field is very rigorous, right? I'm very curious. You said that you were in fellowship for performing arts medicine. I guess in the United States, or I don't know if we can also connect this internationally, if they do have these programs, what does the education and training look like into entering the field of performing arts medicine?
So it kind of depends on what your role is in healthcare, because a lot of the what we call, postgraduate training programs, at least in the US anyway, most of them are geared towards therapists, physical therapists, occupational therapists, speech language pathologists. But as far as physicians, there's actually only one program in the country that has postgraduate training for physicians that are interested in performing arts medicine. And, kind of what I mentioned before, I was very lucky to find out that this even existed because, what actually happened is that I was in my fourth year of med school. And if there are any med students listening out there, I'm sure some of you have gone to the big conferences of whatever specialty you're trying to go in, and you do a lot of networking, right? And so that was me during my fourth year when I was applying to physiatry or physical medicine rehabilitation. And as I was looking through the program, I noticed like there was a session about performing arts medicine. I was like, huh, that's actually really cool. And I went to it, I listened to all the speakers, and I happened, and yeah, and this is something that's very unlike me because I'm a rather introverted person. But after sitting through that session and listening to all the clinicians talk, I was like, I have to see how I can do this for myself, when the time comes. And I actually ran after one of the presenters so I could, just kind of talk to her. Shout out to Dr. Yang Lee, who is my current program director and a dear mentor of mine. But she kind of told me about how, her journey to performing arts medicine came about and that she happened to be part of this singular fellowship program for musicians. And it was like, and this was almost 5 years ago, by the way, maybe even six. But for physicians, there's only one fellowship in the country, and that's at the University of North Texas. Like I said, for therapists, there's a handful of out there that are affiliated that are in big metropolitan centers. I think there is one at HSS and a couple other places in New York City. But basically, this is a very niche field. So the training is it's certainly something you would do after you've gotten your degree and completed your residency. I'll speak from a physician's perspective just to give the whole framework. So basically, if you are a medical student, right, and you want to do performing arts medicine, the majority of physicians who do performing arts medicine, they are physiatrists or specialists in physical medicine and rehabilitation. So basically, you would try to apply to that as your residency specialty. Depending on your program, you might have to do a separate intern year because not all PM&R programs have an intern year built in. So you'll do that for a year. And once you finish that, then you'll do 3 years of physical medicine and rehabilitation residency. And then you can do another year of fellowship, whether it's in, actually in performing arts medicine or what most of my precursors have done before, this fellowship existed is that they trained in things like sports medicine or sports in spine or things like that. So it's about after med school, it's about a 5 year process.
Whew, so short.
Yeah, right.
Just kidding. Super rigorous road for sure. Well, I'm curious, after all the training and the fellowship, and you're finally a board certified performing arts physician, where is the workplace? Where will we find you? What I can imagine is like someone is just in standby behind the stage at
Mhm.
Broadway. That probably isn't the case. But I'm curious, where can performing arts specialists work, or especially physicians work after training? And what does a day in a life look like? And I guess this will lead us into something that you want to share to the people, right?
Yeah. So it's actually a very, very broad field in the sense that you can be based in the clinic. You can also be on site. In fact, most of us, almost all of us who do this do a combination of both, right? So for most performing arts medicine clinicians, they'll have their own outpatient clinic, whether it's in academia or private practice. And then, something then a couple days a week, they might have clinic just for where they see only performing artists, right? So there's the clinic component, and then there's all the on-site stuff, which to me, at least for this past year anyway. That's been a lot. So this is where we actually do go on site and kind of do the backstage stuff you were talking about. So for example, for the ballet, we might go to the ballet studios and we'll have a small room where the dancers and performers, after they're done with rehearsals, they can come see us and we can kind of do a really quick treatment for them. And if they need further workup, then they can come see us in our actual clinic. So there's that component. Sometimes we have clinics at, schools of music and schools of dance, and it's that same sort of format. So where the students and faculty can come get care. Some of them are free. Some of them are through insurance. It really just depends on the arrangement of the school. And then actually we do have backstage stuff, whether as consultants or whether we're on site. In fact, Here Lies Love, yeah. The medical team for that are actually all Filipino physiatrists and performing arts medicine specialists. And that was a very special thing to see. Shout out to Dr. McKay at NYU. So there's a whole lot of opportunity. And also, it's not just the clinical aspect too. We do also do a lot of education. Like for me, that's something that I like to do a lot of. So I might go to schools and conservatories, and I'll talk to the performers and about just how to take care of themselves, so things they can do so that they're better equipped to, one, know when they should seek medical attention from someone like me, or just things they can do to make sure they can have as long a career as possible. So with that, I'm actually starting my own private practice / performing arts medicine group. It's called Medicine for Musicians. And the idea is,
Oh, hi.
thanks. But the idea is that performing arts medicine, like I said, it's a very niche sort of specialty, and it's kind of hard to find us in general. Like I always ask my patients here, like, how did you find us? How did you hear about us? And most of them either heard about us either from word of mouth, from their colleagues, or through a whole lot of Google searching, right? And so through Musicians in Medicine, my goal is to, one, kind of do a lot more public awareness, so to speak, and that I'm going to be trying to talk at the different universities and conservatories and kind of just letting musicians and performers know that there is someone out there who, one, understands them, what they're going through, because, we can speak the language of the arts, and two, letting them know that there's someone out there who can help them with their injuries. They don't have to do this alone. They don't have to keep quiet about it and, the show must go on sort of thing. So that, and then I'm also going to basically just try to expand the accessibility of performing arts medicine through telehealth and then, of course, just on-site clinics. But that's kind of a
Yeah.
spiel of it.
We long for what's natural, yet often hide it with layers. And today's soap market is no different, crowded with products that are harsh and overly processed. Born in Seoul, South Korea, Chai Binu was made to bring things back to something simpler, something intentional. Each handcrafted bar of soap is cold processed in small batches, using only natural oils and botanical powders. It is then cured and air dried for over 1,000 hours, letting the bar harden naturally for a gentler feel and a longer life. It all began with a mother searching for relief for her son's sensitive skin and her refusal to settle for harsh liquid soaps or quick-made bars. Let your skin experience the byproduct of patience, simplicity, and a mother's love. For 15% off at shybinu.com. That's shybinu.com with the code FRANZ. That's FRANZ. What if your night out could come with a smarter tomorrow? Meet Dayguard, a Korean-inspired functional jelly stick designed to support liver health, hydration, gut balance, and vitamin replenishment when drinking alcohol. With science-backed ingredients like DHM, L-cysteine, prickly pear extract, L-arginine, and B vitamins, each convenient and delicious stick helps your body break down alcohol and reduce next day sluggishness. Just take one stick before your first drink of the night and support your body's natural recovery so you can wake up refreshed. Get 10% off your first purchase at dayguard.com, that's DAYGUARD.com, with the code FRANZ, that's FRANZ. One-time use and cannot be combined with other codes. And now I want to veer a little bit deeper into the recipient of the care of all the training and education that you're doing, where all of this is leading into, which is the performing artist, or I guess since we're talking medicine, the patient itself, right? So, according to the Performing Arts Medicine Association, or PAMA, they said that the common goal of the field is to, unquote, improving the healthcare of the performing artist. I mean, you've explained so far, and we do have a gist of what the performing artist is, right? It's the dancers, the musicians, the ballet dancers, the actors, the performers in itself. And these are the usual recipients of your care. Well, my question is, why do you think, and I guess you've answered this a little bit already regarding the complexity and the uniqueness of the medical needs of these patients, of the performing artists. But why? Why does there need to be a separate field for this? I guess, what are the common physical health threats that's facing the performers and performing artists that will require specialized medical care?
I think the big thing is that performing artists in general, they have such a interesting and very nuanced life journey that they're on. And there's a lot of environmental factors, a lot of socioeconomic factors on top of, the physical health, their mental health. And putting all those things together, it really requires someone that one understands the life of a performing artist, the goals of a performing artist, like why they are doing what they're doing. And then with that in mind, being able to adapt medical care to that. Because the thing is, like, not every artist is going to have a huge entourage, a huge support system. Not everyone is Taylor Swift, for example, who can have this huge group of people on retainer whenever 24/7, 365, and she can get the care that she wants, right? She's certainly the exception, not the norm. And especially for the ones who are still trying to make it, they're running the audition circuit. They're doing these off Broadway gigs. They're doing these very small shows. So they're trying to make a name for themselves, get it out there. And so because of that, there's a lot of insecurity, right? Whether it's food insecurity, unstable income, even, living situation, right? They might be, just temporary living with friends or something like that, right? So there's that component. And then there's also just because, one of the most common injuries out there is overuse. And the problem that a lot of artists who are still trying to make it have is that, I have to practice a lot. I have to prepare a lot so I can get good enough to hopefully win that audition, land that gig. And so they'll be practicing many, many hours a day when they, because they need to, on top of working whatever side gig that they have, whether it's something that's not in the arts, just so they can kind of help pay the bills. And, this kind of leads to they get stuck between a rock and a hard place because while they're trying to prepare for these auditions, they'll put themselves under a lot of strain, sometimes a little more than their bodies can handle, and they'll get these overuse injuries. However, they can't necessarily say, oh, I need to take a break now, right? Because the thing with the arts is that if you step away, there's 1,000 other people who are going to try to take your place. It's a cutthroat sort of thing. So that's why, with this in mind, especially for me, a lot of the performers I work with, they are early career, they are students. So they don't have that security yet of a stable paycheck or even health insurance, right? That's another thing too. As independent contractors, insurance is expensive, right? So the idea is that with all these things in mind, if they can come to a performing arts medicine specialist who, like I said, one, understands their life, and two, knows how to adapt traditional musculoskeletal care, medical care, so that it's easier for the performer to do, that's really important. Because, like I said, there's a lot going on in the life of a performing artist. And, to really take care of these patients and, kind of keep them from, really, really injuring themselves, you have to take this very nuanced and individualized and specialized route for care, right? Like whenever I give a
Yeah.
talk, I always say is that my goal is to support you at wherever you are in your career because you have made this choice, this very difficult choice to dedicate your life to the arts, right? And we know how hard this is. And so my goal is to help you build a career where you can really focus on producing the art that you want to create without doing things that might hurt yourself in the future, whether it's physical health, mental health, that sort of thing. I always like to say, may the music never end, right? And so that's why I'm here. Whether I see you once or, a few times, I want to give you the tools and the knowledge so that, you can take care of yourself and that you can have as a long, fulfilling career in whatever your niche in the performing arts is.
Yeah, I love that so much. I mean, that's so beautiful. This kind of reminds me of something that I read while I was researching our topic, which is from the Performing Arts Medicine Collaborative at the Hospital for Special Surgery, which is here in New York City. Hello, best city. Anyways, so they said that the purpose is to help performing artists get back on stage so that they can continue uplifting the world with their talent. And that's kind of true, right? It's very true. Truly performing artists with all of their talents and all of their skills really help make the world a more interesting place, right? It's so crucial and vital to society, which is why you're right. It's so important that we take care of them. And it's very interesting what you say regarding Taylor Swift, right? It's true. She has everything she needs. And meanwhile, I'm sure our friends who are on off Broadway, and I have many friends being in New York City who are Broadway artists who do have these fears of, you're right, insecurity, food instability, or even like just finding the next gig, right? And I just wanted to touch on what you said about, I guess, a lot of the health fears and threats that performing artists face related to overuse. And I'm sure this is in relation to, the whole body, whether it's the voice or the musculoskeletal aspect. I
Mhm.
mean, just thinking of Broadway artists, right? They do like 8 shows a week. Is that
More or
correct?
less, it's a very, very intense schedule, especially if you think, the ones that do multiple shows a day, right? Like they have the matinee and then they have, the evening show. Like, even though the show itself might only be a couple hours or something like that, there's also the stuff before and after the show, right? That they still have to do. I mean,
Mm.
sometimes people don't even have time to really eat or hydrate themselves. Like if we think of like athletes, right? Very important, of course, that they need to keep themselves fueled. So the same thing can be said for performing artists, but just by the nature of their schedules, they don't always have a lot of time to even do that. From my own personal experience, and I know, of course, just talking with my patients, the life of a performing artist can be it's very exciting. Don't get me wrong, but on the other side, it is rather chaotic. Most people will, the schedules are very much all over the place, right? And that can be difficult, in terms of just long term health and stability, durability, that sort of thing.
Yeah. And from the lens of a physician and being the master of the human body, I wanted to ask, what does overuse of these in the performing artist's body physiologically, what does it do to the body, or what can happen to the body from
So
overuse?
I think the easiest way to think about it is that, for example, when we do, a workout, right? When we're lifting weights and doing, that sort of thing, we're breaking down muscle, right? So that we can build it back up. That recovery, it doesn't happen immediately, right? You need at least a day or two for your body to recover. And so with performers, and I'm going to speak, I'll kind of illustrate this from the life of a musician because, that's what I'm most familiar with. But so, for example, a violinist who is in the practice room and they're preparing his concerto, right? Concerto is like, the showpieces, like those big compositions that every musician is trying to learn. These are compositions and pieces that are, anywhere from 20 to 30 to 40 minutes in a row, right? There's a lot of technical and also artistic nuances to it, right? And so when a musician is practicing these in the practice room, there's a lot of repetitive movements, right? These small, very specialized repetitive movements over and over and over again. And to give you an example, in music school and conservatory, it's not uncommon to hear people saying they're practicing for 3, 4, 5 hours a day. That's just practice, by the way. And then on top of that, they might have to play in studio class, which is, they play for their peers within their own studio. That might be 20 minutes or an hour or something like that. And then they have rehearsals in their school ensembles, and then those might be 2 to 3 hours, right? And then, they might have just gigs that they need that they're taking on just so they can make money. And those could be from anywhere from, 1 to 3 hours, right? If we add all of those up, that's a lot of playing time, right? Are all those things necessarily happening on the same day? Not always, but it does happen. But the point is that especially at the early career stage when musician is really developing themselves, trying to find who they are and also just become better, they're putting all these hours on their muscles, on their body every day or almost every day, right? Without really much time to recover. And oftentimes, if we think about how we were in undergrad, and this is still technically kind of true, is that, when we're young, right? As weird as that is to say, our body can get away with a lot, right? And you don't really see the consequences of that until down the road. And that's very, very true with artists, right? Because they've been putting themselves through all these hours of these repetitive motions and never really had a chance to recover. And they don't have a chance to refuel properly, rehydrate properly. All the recovery sort of things that, an athlete might do. Performing artists either aren't usually doing that, whether it's because of just lack of access or just lack of time or some combination of the above. And so, with all of that in mind, eventually, that's the thing with overuse is that it's not necessarily that happens overnight. It's something that happens over a decent amount of time, whether it's a few months, a few years, and because there are signs and symptoms that people can look out for to be like, oh, wait, something feels off here. I should probably cut back a little bit or change the way I do things. But a lot of early career musicians, they don't necessarily know what the signs are. And so they'll just keep going and going and going. And then eventually things just fall apart. And then they have chronic pain. Pain is, of course, very complicated, but, just for simplicity's sake, that pain is going to affect the way that they play. But obviously, so they'll try to play through the pain. But of course, anyone who has, tried to play through an injury, whether it's on the athletic field or wherever else, it's not the most comfortable thing, but you're trying to focus on something besides that thing that you're working towards.
What if your home could feel more like you? Meet Emmy, a New York-based home fragrance brand founded in 2020 by Erica and Mark. Inspired by the scents they grew up with, like steamed rice, tropical fruits, and temple incense, Emmy celebrates fragrance as memory, culture, and ritual. From design-forward candles to reed diffusers and hand soaps, each product is crafted with clean ingredients, wood wicks, and thoughtful formulations. More than scent, Emmy creates atmosphere and belonging, storytelling in wax, in water, in air. So whether it's lighting a candle or washing your hands, small rituals are transformed into something intentional, making your space warm, alive, and entirely yours. Get 15% off at emmynyc.com. That's EMMENYC.com with code FRANZ. That's FRANZ. Find your story, find your atmosphere, find it with Emmy. There are trips, and then there are experiences. Imagine a journey where beauty meets meaning. Your K-Beauty Tour is a 7-day privately curated immersion in South Korea, blending Korean skincare expertise, holistic wellness, and cultural depth, from the trend-setting beauty districts of Seoul to the serene beaches of Busan. Personally hosted by leading beauty and wellness content creator and my dear friend, Daniel O, this experience offers access you simply cannot get on your own. From palace courtyards where empresses once prepared their skin with hand-ground herbs, to private aesthetic consultations, bespoke color analysis, exclusive spa therapies, and blue ribbon level dining. With intentionally limited spaces for May 10 to 16, 2026, this is beauty elevated to ritual, where skincare becomes ceremony and travel becomes something unforgettable. Visit yourkbeautytour.com to learn more and reserve your place. Based on our conversation so far, we see the very specialized, situation of performing artists. Well, I wanted to talk more about the specific treatment modalities for this special domain of patients. You mentioned earlier on in our conversation that it's quite different, right? I guess for the general public, you'll say if they have a musculoskeletal injury, it'll be like rest and ice and compression if they still do rise. How is that different for, let's say, a ballet dancer who pulls their muscle or a vocal artist who gets nodules? How different? And I guess what do you usually do within the field of performing arts medicine when it comes to treatment and care?
Really, the first place we always start is one, where's the performer? Where are they at in their career? What are their goals? What are their short term goals in the sense of what performances do they have coming up? Do they have a recital? Do they have a concert? Do they have an audition? We think about that, the short term aspect. And then we think of, their long term goal. Are they on a performance sort of track in that they want to, play concerts, join an orchestra, join a company? Are they on an education track? That sort of thing. So first, we figure out what that is because based on their goals, this is how it becomes really individualized. Based on their goals, that's how we kind of tailor our management plan, right? So, for example, a pianist who has a wrist injury or hand injury, right? Let's say they have a very important recital coming up in a couple months, and they also happen to be a student, right? So, depending on the severity of the injury and also just on the other things that the musician may be doing, whether it's, other rehearsals or paying gigs, it's not always realistic to go get therapy, physical therapy, hand therapy, that sort of thing, right? And so, in that circumstance, we will work with the musician to come up with a treatment plan that focuses on symptomatic management, right? Whether we can teach them how to do, their own myofascial release or, what we do here. I'm a DO, so we do a lot of osteopathic manipulation, which is basically a form of manual therapy. Really just all we need is our hands, right? And of course, it's very low cost. That's the most important part. So we'll do things like that for them in the office. And then we might, in terms of medications, we have to be very careful because the idea is that they have to play this recital in a couple of months. They can't take the time off. So we just want to get them to the finish line, right? And so, we can do manual therapy for them in the office. And then we also can work with them to make a practice plan such that they don't overload themselves too much. So, for example, one thing I always like to say is when practicing, if you're thinking of an hour is actually going to be 50 minutes, not 60. And then, basically, I would tell someone okay, you can practice for 20 minutes, right? And then take a 5 or 10 minute break and, reset that over the course of an hour. I would also tell them to pay attention to their pain because if they exceed a certain level of pain, then they need to stop. And then I kind of have them back off a little bit, take a little bit of longer break, and then, kind of go back at it. Just paying very much close attention to how they are feeling. And then on top of that, in certain circumstances, we do use, medications, but we often tend to use the more conservative ones. So things like topical NSAIDs, for example, like Voltaren. The thing is, and you certainly know this, is that when it comes to pain medications, a lot of them can have certain side effects. They might be a little sedating, right? They might affect you cognitively. And especially for an artist who needs to be really, really on point and very accurate with what they're doing, you giving them a medication that makes them a little loopy, that's not really going to help. So there's that component. And then after they've done their short-term goal, they've finished that concert, then, we can have them come back and we'll make a more comprehensive rehab plan, where they would see a therapist. I mean, they could still see a therapist for their short-term goals, but, when they're able to work on their long-term goals, then we can get them into a formal therapy program with PTs and OTs who also understand how to work with artists. And then we also talk to them about prevention, things like what they can do so that they don't have these injuries again. So whether it's, again, load management, nutrition, sleep, that sort of thing, all within the context of their own situation. Not everyone has, the resources to get groceries all the time or like good food all the time, right? So we really help them out with resources and also just the knowledge and how to kind of navigate that as best they can. The other thing is too is like some musicians, they can't always see you regularly, so we want to maximize the time that we have with them, right?
Yeah, and as you mentioned before and have just mentioned, there is a financial determinant in this life of a performing artist, right? I guess there's a lot come into play when it comes to getting paid or what their pay are and how that matches their living situation. And we talked about groceries and even health insurance as a
Mhm.
whole, right? Like, it's probably a complex topic as well within this specific patient population. So I remember during our introductory call, you were telling us because of this, and in regards to the limitations of which medications they can take as well to prevent the more sedative and the somnolent side effects of most pain medications, you told me that they had to get creative on how they do things and how they reach relief from any pain or any injury. And you have mentioned some modalities that were, I guess, more non-traditional, or I guess how ethnocentric of me, more traditional in nature, more Eastern medicine, right? Can you talk more about
Yeah,
that?
yeah. Like I said, we have to really work within, whatever the resources that are available to us, whether it's us or the musician. And so for a performer, something that a lot of performers get decent relief from are things like acupuncture or gua sha, and also kind of similar to like what we do as DOs with osteopathic manipulation. Because all of this, it's not that expensive. All you need is, someone who has good hands. And then in terms of acupuncture, aside from, knowing all the points, they just need the needles, right? And a lot of this is very cost effective. And because it doesn't negatively affect their ability to perform per se, a lot of our performers, they really do well with those sort of treatments. Like I said, just the whole having to be creative, kind of think outside of the box and how to best take care of our artists. Things more on the, less traditional side, you will see that a lot in our field, and our patients really, really do well with them.
I love that convergence of, I guess, more of this very niche and very modern field of performing arts medicine with more, I guess, Eastern and more traditional routes and modalities of care. I've learned, and I know our audience have learned so much today too, regarding this very niche and subspecialized field that's, I guess, ever growing, right? We will always have performing artists, and I hope we do. I'm curious, what is your goal for this field of performing arts medicine, let's say 5 or 10 years from now?
So for me, and that's kind of partly why I'm starting my consulting group slash private practice, musicians in medicine, is that I want to raise awareness such that more artists, especially early career ones, especially, the ones who are still figuring who they are and trying to make their niche. I want to let them know that there is someone out there who, one, understands what they are trying to do and will support them in, achieving that goal, and will really take the time to find a plan that actually works for someone that's in the arts with that very unpredictable sort of lifestyle, right? And so with that, like I said before, I really like working with students and early career musicians because, like I said, I want to give them the tools to, one, be better equipped, two, how to take care of themselves, how to increase the longevity of their health and therefore their careers. And, just also knowing, well, one, when it's time to reach out for help, and two, who they can reach out for help. So that's what my long-term goal is just to really get the word out
Yeah.
there and let people know there's someone out there who understands and really wants to see you succeed.
I love that. I have so many friends in the Broadway and the performing and the music space. It's very inspiring to see how they soar through the clouds to fulfill this passion of theirs. Or even when I watch concerts, right, in the Lincoln Center or even a Broadway show, and you see all of these so talented and skilled performers just living their lives and just sharing to the world the gift that they were given. It's such a beautiful thing to see. And it's very reassuring to know that there is a specialized domain that caters to their goals, who understands what they are going through and what they need, right? So thank you so much, Dr. Francois, for sharing your field to us and just being there to let us know that our even our favorite artists can have someone to lean to, right? And so, can you please share to everyone how they can find you online?
Best way to
Yeah.
contact me, medicineformusicians.org. And just FYI, even though it says, musicians in the name, this is, of course, open to all performing artists. Doesn't matter if you're a musician, if you're a dancer, if you're a singer, if you're an actor, actress, I can help. Reach out to me, and if there's anything that you need, we can set up a time to talk, and I can try to help you out. And also, depending on where you are in the country, I can also direct you to people who can also help you out. And then, the Instagram is the same. It's Medicine for Musicians.
Yay, I love that. Thank you so much, Francois, for joining me. This was such a great conversation. And let me go ahead and watch Wicked again.
By all means. Thank you.